Hello, my name is Jared Ursulan, and I'm currently in the final year of the Bachelor of Kinesiology program, majoring in Human Kinetics out of the University of Regina. My place of fieldwork this semester was at the Alberta Physiotherapy Clinic located in Medicine Hat, Alberta, which is a private practice clinic that works towards helping clients of a variety of different backgrounds, from athletes to WCB and the general population, recover from injury or surgery. Many of these clients come in with their own goals and objectives, whether it is returning to sport, returning to work, or just being able to perform everyday tasks without pain or discomfort. APTC uses different evidence-based practices such as hands-on treatment and exercise rehabilitation, among other things, in order to help the clients achieve their goals. I have had a small amount of experience working with athletes in exercise and conditioning settings, but my role at the clinic revolved around exercise rehabilitation, which was a new area for me. I would create and modify exercise programs tailored to that individual based on their injuries, as well as go through proper lifting and movement technique. This is also where the idea of choosing my special project came from. The special project I worked on was dealing with non-surgical ACL rehabilitation. The purpose of this project is to help shed light and educate people on possible different route rather than having to get surgery, and hopefully being able to provide this as an option for people in smaller city centers such as Medicine Hat. By having a subject who had an ACL injury, we're able to perform tests such as the hot battery test in order to compare the injured knee to the non-injured side. Some of these tests were the single leg broad jump, crossover hop, and the 6-meter timed hop, as well as the triple hop test. With measuring the distance between the injured and non-injured side, it allowed us to compare the two sides, with our goal being to have a strength in the injured leg to be within 10% of the non-injured side. In order to meet this goal, it is important to strengthen muscles that deal with the hip, knee, and ankle. From there, I used the Melbourne ACL Rehabilitation Guide 2.0 created by Mick Hughes and coworkers out of Australia as a baseline in order to develop a strength program. These exercises are meant to strengthen the muscles around the hip, knee, and ankle, such as the quads, glutes, hamstrings, abductors and adductors, and the calves. The goal with these exercises is so that the subject can perform a certain amount of reps without fatigue or pain. Once they have reached this goal comfortably, then we would be able to move them further along in the rehab. In terms of progression, we would move on to practicing jumping, landing, and cutting in order to get into that 10% strength window. However, due to limited time, we just continue with the regular strength program. We felt like we had some slight success as shown in the subject's test results in the second test, as they were very close or in that 10% window. The biggest thing I would do differently would be to fully implement the proper amount of time. With the research and knowledge that I gained about this project, the most important thing is time and patience. Non-surgical ACL rehabilitation is still gaining traction in the world, but as more research becomes available, it can be used in many clinics across Canada, such as the one I worked at, as a viable option from surgery. This is a topic that very much interested me, from looking up research, being able to talk and listen to various PT professionals, and even doing some of my own personal research, that I began to build a better foundation in ACL injuries and rehab, and this is something I could continue to focus on in my future career.